I've been running, I've been meditating, I've been taking a lot of deep breaths, and I'm also seeking therapy for myself to process everything that's going on. My name is LaTanya Lemon-Cumper. I go by Tanya, and I'm a physical therapist assistant in a nursing home in Harlem, New York. Parenting during COVID, it's been extremely challenging, especially when you have a child with special needs. There's been a lot of tears on my end and his end because he wants to play with his friends. He wants to go back to school. He thrives on routine, and the routine has been disrupted because of COVID. Unfortunately, my husband's business has been impacted by COVID because he works in a martial arts studio. Fortunately, because of that, my husband's been home managing all my son's therapies, his teletherapy, and his school activities. And so by the time that I do come home, I'm able to interact with my son, take him outside. In fact, yesterday, we had a water gun fight. He insisted. My son insisted on having a water gun fight. And so we did because it was warm enough. And he can't go to the park and play with his friends. So we have to meet him halfway and compromise. Running is my salvation. I love running outside, and it's a great way for me to clear my head. I love my job. I love my coworkers. I enjoy what I do, but I'm also scared as well. But when you sign up to be a healthcare provider, this is part of it. Unfortunately, patients that were very healthy, they suddenly die, which has been very stressful. Oh, that's a very loaded question, because we could talk about how mostly people of color have been impacted by this disease due to lack of testing. Um, Me myself, I had difficulty getting testing at first. I did test negative. I still need to get the antibody test. But for myself, being a healthcare provider and a person of color, it was very challenging for me to get testing. There's a history of people of color advocating for their health and then being pushed away with devastating consequences. Kids with special needs, we are definitely hurting the most out of this crisis. As far as like all the school kids are concerned, I feel like kids with special needs are being hurt the most. It's been very difficult to have my son wear a mask because he also, with his diagnosis of autism, he also has a sensory component to it as well. And part of the sensory component is when we try to put on the mask, it made him feel uncomfortable. So what we have done, we've explained to him how the mask is very important to wear. If you don't want to wear it, that's fine. Just remember, cough in your elbow, use hand sanitizer. And in fact, after we're done playing, he's often asking for the hand sanitizer. So we know that he's actually listening to what's going on. We all get stressed out, as we do need a time to take a break for yourself, for oneself, and take a couple moments to breathe and reset, and then go back to doing what you need to do to make sure that your family is being protected and safe and healthy during this crisis. It seems like it's coming out through play, how he's understanding the crisis. So play with your kids, and if you need a timeout, put yourself in timeout as well. I have no problem telling my son, mommy needs a timeout to calm down and relax and process what's going on, because it's very heavy. It's heavy for everyone. Although I'm going through a lot, I can acknowledge the privilege that I'm one of the lucky ones. I really am.